Well, diabetes, it's a disease many people deal with on a daily basis, but do you really understand how to manage it or what it even is? I want you to meet Alexis Ryan. She's a Cigna Medical Group clinical pharmacist, and she's here with all the important details that we need to know. And first of all, welcome to Sonoran Living.
Thank you for having me.
I am so excited that you're here because diabetes is a little bit tough to understand unless you have it,
right.
To know really what it is. Explain what the disease is.
Right, so diabetes is simply a condition that develops when people are unable to process the sugars that we eat in our foods effectively.
Okay.
So a person who doesn't have diabetes, for example, we eat foods, our bodies break that down into sugar, and our pancreas produces a hormone called insulin. And insulin, all it does is help us chew up our sugars in our foods and bring it into our muscles and our brain where we need it for energy. A person with diabetes either doesn't make enough insulin or doesn't use that insulin properly, so that sugar ends up just staying in our blood. The reason we don't like that is blood that's really high in sugar is really thick and sticky like maple syrup. So just imagine trying to push maple syrup through the tiniest little vessels of your body, in your brain, your heart, your kidneys, your fingers. And that's how we can develop complications of diabetes, like heart attack, stroke, because we're causing damage when we're trying to push that blood through those vessels.
That makes perfect sense. I have never heard it explained that way, right? Think about that, right? The maple syrup. I love that analogy. But what causes it? I mean, is it genetics? Is it something that we're doing to ourselves? What is it?
Sure. So this is a conversation we have with our patients a lot at Cigna Medical Group. What you can control and what you can't control. So what you can't control, age, genetics, family history, or even having high blood sugars due to pregnancy. But what you can control are things, like how much excess weight you're holding on to, the foods you're eating, and how much exercise you have on a daily basis.
So how do we lower those chances? Like you just said, we can do all of those things, but some people are predispositioned, some people aren't, educated enough. A lot of it might be socioeconomic status.
Right.
How do we prevent it?
Well, I think the first thing you really need to do is make sure you're getting into your doctor and getting routine lab work done. That'll tell you what your fasting blood sugar is and what your A1C is.
Know your numbers,
Know
right?
your numbers, exactly.
Okay.
If your blood sugars are over 100 fasting, your A1C is over 5.7, you're at risk of developing diabetes. Also make sure that you're, talking about your excess weight. Exercising on a routine basis, because lowering your weight and exercising actually helps your body to use insulin better, more effectively.
Okay.
And then just remember always your diet. What you're putting into your mouth is going to affect your blood sugars.
Absolutely, and that diet is all so important. And it seems like a diabetic diet is just a good diet for you to have anyway.
Yeah, I think taking some of those concepts into practice is really helpful. There really is no true diabetic diet, and we want our patients to start thinking about it not like a diet, but a lifestyle change. So talk to your doctor, have a conversation about what you eat normally, and try and pick 2 or 3 things that you can do, that you can manage to help lower your overall carbohydrate intake and lower your blood sugar intake. That's going to make the biggest difference, because this isn't a diet. This is a lifestyle change that you have to try and incorporate to lower your overall risk.
Right.
But also just keep in mind, these aren't things that you're going to learn in a day. They're not things that you're going to learn in a week. So what we try and teach our patients at Cigna Medical Group is go to your doctor, have those conversations about what your risks are, what your existing lifestyle changes are. Make sure you know your numbers, know that A1C, know that fasting blood sugar, and then just make sure to take control of your health and make sure that you know what's increasing your risk.
Yeah, it's all about empowering yourself and educating yourself, and you just did a very good job of getting us started with that, so I appreciate that. And of course, there are many more services to learn about, all provided through Cigna. All you have to do is make one phone call to find out. Get your questions answered at 1-866-627-7782, and TTY users should call 711. You can call Monday through Friday from 8 a.m. until 8 p.m.